Hey everyone, this is Daily Dose of Medicine. In this video, we will talk about signs and symptoms of enlarged prostate. Enlarged prostate, also known as BPH, benign prostatic hyperplasia, which is a common condition that affects many men as they age. Before we get started with the signs and symptoms, I want to talk about the risk factors and causes. The prostate gland naturally undergoes growth throughout a man's life. This growth is mainly hormone dependent, particularly on testosterone and other male hormones called androgens. BPH, benign prostatic hyperplasia, is primarily a condition of aging. The most important risk factor is increasing age. The prevalence of BPH increases with age, especially in men over the age of 50. By the age of 60, more than half of men will have some degree of prostate enlargement, which is a significant number, and by the age of 80, about 80% of men may be affected. That's why we recommend regular checkups with a healthcare provider, especially for men over the age of 50. In checkups, we usually do physical exam, if it's needed, blood tests, and if it's necessary, prostatic biopsy. As men age, there is an increase in the conversion of testosterone to DHT, dihydrotestosterone, in the prostate gland. Dihydrotestosterone is a potent androgen that plays a role in stimulating prostate cell growth. DHT is also one of the contributors of the hair loss in men. Other risk factors that we can talk about are family history, genetics, and lifestyle factors such as obesity. But we have to know that BPH is different than prostate cancer. BPH is a non-cancerous condition, and having enlarged prostate does not increase the risk of developing prostate cancer. However, both conditions can cause similar urinary symptoms, so it's essential to differentiate between the two through medical evaluation. That's why we recommend checkups after 50 years old. The first symptom that we will talk about, frequent urination. This is an important symptom because it's not just increased need to urinate throughout the day and more notably during the night. Nocturia, which is a term for waking up one or more than one time per night to urinate, can be particularly bothersome as it disrupts the sleep and can lead to fatigue and reduce quality of life. This frequent urination can cause fatigue and reduce quality of life. So it's important to know this. The enlarged prostate compresses the urethra, which is the tube that carries the urine from the bladder out of the body, making the bladder more sensitive to even small amounts of urine. The other symptom is difficulty starting urination. With an enlarged prostate, the prostate gland can compress the urethra, creating a resistance to the flow of urine. As a result, it may take longer for the urine to start flowing once you are at the toilet. There's difficulty in initiating urination referred to as hesitancy. Doctors may use this term, hesitancy. Weak urine stream. The flow of urine can become weaker and less forceful due to construction caused by enlarged prostate, instead of a strong and steady stream, which we will see in healthy individuals. The urine may come out in a weaker, sometimes in intermittent manner in prostatic enlargement patients. We have a phenomenon called double voiding experienced by men with an enlarged prostate. After urinating, they may wait a few seconds and then attempt to urinate again. Dribbling at the end of the urination can be seen. After finishing urination, some men experience dribbling or leaking of urine. This occurs because the bladder does not empty completely due to obstruction. When you stand up or move, the remaining urine may leak out, leaking leading to dribbling. Incomplete emptying is important because despite feeling the urge to urinate frequently, the bladder may not fully empty itself due to obstruction. This condition is known as urinary retention and can lead to two problems. One is persistent discomfort, and other thing is increased risk of UTIs. We will talk about UTIs in the next slides. Urinary urgency is another problem. You may experience sudden, compelling urge to urinate, and you might not be able to postpone going to bathroom. The feeling of urgency is due to the bladder becoming overactive in response to obstruction. Decreased sexual function, which is an uncommon symptom that can be seen in some men with BPH, and we could see erectile dysfunction or reduced libido. The exact mechanism linking BPH to sexual function issues are not fully understood, but may involve both physical and psychological factors. Let's talk about urinary tract infections. The stagnant urine, just because of the urinary retention, the incomplete emptying is the cause of stagnant urine, can increase the risk of bacterial growth, leading to UTIs. The symptoms we will see with UTIs are burning or pain during urination, cloudy or foul-smelling urine, and frequent urination. Let's talk about blood in the urine. In some cases, an enlarged prostate can lead to hematuria, which is the presence of blood in the urine. Blood in the urine may be visible. If it's visible, we say gross hematuria, or it could be detectable only under a microscope. In this case, we say microscopic hematuria. Blood in the urine is important. It's essential to seek medical attention promptly if you notice blood in the urine, as it may indicate other serious conditions that needs to be investigated. It could be caused by urinary tract injuries, medications, glomerular problems like IgA nephropathy. So you should seek medical care. Remember that these symptoms can vary in severity from person to person, and some men may experience only a few of these symptoms, while others may experience several. The symptoms are personal. If you're experiencing any of these signs, it's essential to consult a healthcare professional for proper evaluation. For diagnosis, we could do physical exam and blood tests. And management. Management is personal. Early detection and appropriate treatment can help improve symptoms that we have talked about and prevent further complications. Thanks for watching. Don't forget to watch our prostate exam benefits, risks, and don't forget to watch our folate deficiency signs video. Don't forget to like this video, share this video with your friends. See you on the next one.